Okay, we will call the Human Services meeting to order. Thanks everyone for being here. First item on the agenda is approval of the agenda. The chair will entertain a motion.
Order.
Thank you, Commissioner Snell and Commissioner Williams. All in favor will please say aye. Aye. Any opposed? Thank you. Public comment. Public comment is now open. Each individual please state their name and has 3 minutes to address the board. Public comment is now open. Any public comment? Last call for public comment. Public comment is now closed. We move now to committee items. The minutes of last month's meeting, the chair will entertain a motion. Thank you, Commissioner Snell and Commissioner Bear. Any comments on the minutes? All those in favor will please say aye. Aye. Any opposed? Thank you. We now move to appointments to the perennially vacant Sanitary Code Board of Appeals, alternate positions for a contractor and a well driller. Are there any nominations from the board? Hearing no nominations, we will continue to leave those open and hope that, Commissioner Snell, please.
I can make a recommendation. I know that we've been posting these positions. Have we gone any further than that and going soliciting right directly from these companies?
I've spoken with the Home Builders Association of Jackson and with some constituents of mine who seem to be mildly interested but who have not as yet made an application. We've gone so far as to send the application forms to various people. Please apply. And one guy said he had a friend who was was a contractor or a well driller. He had a friend who filled the opposite criteria. It only meets when there is an action by that, correct me when I get this wrong, Kristen. It only meets when there is an action by the health department with respect to sanitary issues, septic field.
Not very often.
Not very often. Only when the health department turns down an application and the resident wants to appeal that. If I get it right? Okay, thank you. I'm getting thumbs up from the health officer, which would be rare in my case. So thank you, Madam Health Officer. But it doesn't meet often. And frankly, in my experience, when it has met, and Commissioner Walls may also chime in here, typically they'll find some way to achieve what the landowner wants, but the health department just couldn't approve it initially, more or less, right?
Correct.
Am I right? Right.
That's
Okay.
correct.
So it's not a heavy lift, and actually for people who want to see government actions changed, it is kind of a juicy little nugget for them.
Thank you very much.
Also correct, right, Kristen? Okay. Okay, yeah, I would welcome any thoughts anybody has on how to fill these 2 vacancies. They're not heavy lifts. We'll move on now to the DHHS quarterly report. Call in the new county director. Madam Director, congratulations.
Thank you. Good afternoon, Commissioners. I'm Jackie Carafino. I am the new Jackson County DHHS Director. I just started on the Monday before Thanksgiving, so November 25th, and I'm honored to be here and to be leading our Jackson team. So thank you for having me this afternoon. I wanted to tell you a little bit about myself. Born and raised here in Jackson. I went to school out in Napoleon. I have an undergrad at Michigan State and my master's degree at Eastern. I'm married to a retired sheriff's deputy from the county, Corey Carfino, and we have twin boys who are going to be 16 next week, and I get my life back a little bit from the running. So excited about that too. Just very honored to be selected and proud of our Jackson team. Just as always, if there's any items of interest that aren't covered, please feel free to contact me at any time. I did bring some business cards if anybody would like one before I leave, or I can leave some on the table for you as well.
Yeah, please make sure each of the committee members gets one of your cards.
Okay.
Thank you.
Okay, you're welcome. I'll just report on just a couple items. Just our child care fund update. We have just started our new fiscal year, and so we're very early in the budget. So these numbers were at the end of October. So we were at 11.48% with only 8% of the budget year lapsed, which is not uncommon for that first month in the fiscal year. That will ease back a bit as we move into the coming months and will level out. That is typically what we see. For our, I'm not sure if Zoe reported this last time she was here, but we're still waiting for our staffing allocations. I don't know if that's familiar or unfamiliar to you all. We don't have those still as of today, but I anticipate those coming in the next couple of weeks. So we had a pretty significant staff reduction in our children's services team primarily last year, and so we're kind of waiting to see if we get any of those spots back. So I will keep you posted on that. I should know more the next time we're here. So for our assistance payments team, and that side, we're heading into the cold winter months, so our state of emergency relief applications are going up, and that is the bulk of the priority at this time. Those are folks that might have shut-off notices or have no electricity or heat, have some of the utilities shut off, or need some emergency help with housing. So those are picking up, and that's kind of where our energy is at the moment for our assistance payments team. It is Christmas time, so we're heading into our Angel Tree program. That is where we serve the families that are on food assistance in Jackson County. They're invited to sign up for gifts for their children over the holidays. This is a huge gift-giving opportunity for the community, and we service many families. We have our highest number yet at gifts for 1,387 children, and those are being housed in our first floor conference room, and our doors are open for parents and families to pick up those gifts starting today. So we're in the thick of that, and the same with our Operation Good Cheer, which are gifts that are provided to us for our children that are in foster care. Those gifts are also at our building and ready to be delivered, so we're doing pretty well and feel like we're ahead of the game at this point as we're talking today. That will change by the end of the week, but we're doing well. Zoe spoke a little bit about our request for a partnership with the YMCA of Jackson for our families who their children have been removed and they have achieved reunification, so their children are back home with them. There were grant monies that were received and have now been dispersed to the YMCA to be able to partner with us to provide YMCA membership to our families who have successfully reunified. So we're excited to be able to offer that to our families, and it's a great partnership with the YMCA. And then attached to my the commissioner's report is a director's report, and that's a list of our community meetings and our DHHS meetings that you'll see there. And I think that's also not unfamiliar. You're used to seeing that as well. So if you have any questions on that, I'd be happy to answer those or any others that you have. And if there's a need for any follow-up, I'll certainly be happy to do that. Thank you for having me.
Questions for the DHHS? Commissioner Willis?
Thank you, Mr. Chair. First, I want to say congratulations to you, Ms. Carafino. We've had the opportunity to work with you some in the past on some group violence issues and everything, and really impressed with what you do. Looking forward to having you here. So,
Thank you.
yes,
I'm happy
ma'am.
to be here.
And then my question was as to the assistance payments.
Yes.
If there's a family that we know that is in need of that, the emergency relief, is that an online form? Is that something?
Yes, they're also able, we do have service in our lobby. So if they were to want to come up to the DHHS building as well, we have folks that can help them, even if it is online. We have navigators sort of in the lobby. I call them navigators, but staff that are helpful and can help them get started at least. But yes, they can apply online as well. So both options are available.
Okay. Thank you. Thank you,
you're
Mr. Chair.
welcome.
I will note that at First United Methodist Church, my wife has adopted, I think, at least a couple of kids and has almost single-handedly been keeping Amazon in business.
Yes, as she should be.
Yeah, so it's like every day, there's a drop-off at the house. So, but she loves doing that, and thank you
good.
guys for making it a pleasant time of year for those for whom it might not otherwise be a
yeah.
pleasant time of year.
Well, we're honored to do it. Thank you.
Carry on the good work. Chair will entertain a motion to receive the report. Thank you, Commissioner Willis and Commissioner Snell. All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
And now the Medical Care Facilities Quarterly Report. Madam Director.
Good afternoon, Commissioners. So first for you today, I do have a special report on the Medicaid audit adjustment that we spoke of last month. So that presentation is going to look similar to what you received last month, and then starting on slide 7 is where we'll actually start talking today. And that's going to be the other presentation, I'm sorry. So I'll just wait for that to get on the screen for you. Yes, it's the PowerPoint. We brought a few extra excerpts today. So yes, this is the one, and then starting on slide 7. So we included all of the information we covered last month so that you would have it all available in one individual packet. But slide 7 is where the new information starts. So I provided a new copy of the timeline that just outlines the process of the cost report, the cost reporting timeline also. So starting with the orange, that's the state fiscal year timeline, the state cost reporting timeline in blue, and then the Medicaid rate calculations in yellow, which I realize is very small to see, and hopefully when you're able to blow that up on your computers, it'll be a little easier to see how those rates align across the timeline, and then the facility's cash flow timeline in green. So I'm going to go through the narrative of this timeline and just have this as a tool for you to be able to review. So on the next slide, I want to talk a little bit more about fiscal year 2022's cost report, because this cost report ends up being a double-edged sword for the facility. Originally, we talked about $1.7 million that was going to have to be paid back to Medicaid due to reconciling past payments that we were overpaid for due to the errors on the cost report. But this cost report also set the rate that we were paid for all of fiscal year 2024. So those same errors led to Medicaid overpaying us for the entire fiscal year 2024, which ended on 9/30 of 24. So that creates a new repayment issue for the future of $1.9 million. If you go to the next slide, I just want to draw attention. We've talked about 22, we've talked about 24, but we haven't talked about 23. The reason for that is with the current cost reporting system, even years affect even years and odd years affect odd years. So at this time, 2023 is not involved in any of this process. The cost report for fiscal year 2023 was filed on 5/31 of 24. It still remains unaudited by the state Medicaid office. We have reviewed it to make sure that it does not have the same errors as fiscal year 2022, and those were not repeated. But because fiscal year 23 is also a double-edged sword year, where it sets past payments and reconciles those past payments, and also sets the rate for fiscal year 25, which just began on 10/1 of 24. We've decided to engage Plant Moran in auditing that cost report ahead of time to make sure that there are no additional issues that we may not be aware of. So we'll keep you posted on that in our future updates. But at this time, 2023 is not involved. So since our last meeting, which is, yep, on that slide, we did accrue an estimated take-back of 1.5 million based on Plant Moran's reanalyzation of the issue. It should be 1.7 million. So we are going to correct that as part of the November financials. We did reduce the 2024 non-operating revenue and recorded a corresponding balance sheet liability. And then again, we'll settle that up at a future period once we receive the invoice. At this time, our estimate for when that invoice could be received is any time now between the end of, now through the end of this year, or up until we expect closer to fall of next year, that we'll receive the invoice for the 1.7 million. For the 1.9 million, we are not expecting to see that invoice until next fall or possibly the fall of 2026. So this could go out some time before we actually see the invoices. So we wanted to make you aware of that timeline. On the next slide, I did include some calculations just so that you guys can see the impact to fiscal year 2024 and how that was overpaid. So the Medicaid rate for fiscal year 2024 was $334.66. The audit concluded that it should have been $295.37, creating a difference of $39.29 per resident per day. We had a total of 49,664 days of care, which comes out to that total of roughly 1.9 million. So our plan is to accrue that estimated take-back on November's financial statements. So all of that money is earmarked for repayment when those invoices come in, and it's all going to be taking place on this year's financial statements.
Let me make sure I understand that one. Go ahead, Mr. Chair.
Are you allowed then to, for lack of a better term, protest your billing rate and able to get reimbursement even after you've been denied it the first time? Can you go back for a second time reimbursement under protest and say that it did cost us this amount of money and was only an administrative error that shows these flaws to billing?
The problem is we didn't actually spend that cash for those two errors, so we can't go back and ask them to reallocate that as expense because there wasn't actually expense that was created there. So there was an actuarial expense, but there was no actual cash changing of hands expense that we can do that.
So you didn't, it wasn't that you got overpaid for services provided, it was that you created an actuarial billing and billed for it, but never had the real incident occur.
So we had the actuarial cost of the OPEB liability for retiree healthcare. And so typically in the cost reporting process, that actuarial amount is taken out of the cost report, but in this case, it was left in error. So, and those are not eligible for reimbursement.
Go ahead, Mike.
So just for sake of clarity, the ARC is a payable. You do have to pay it into the pension system, so it is an expense.
But because we didn't have to pay,
You just can't pay it using the other money. No?
no, so the actuarial expense for that piece doesn't have, it didn't meet the amount that needed to be paid into the OPEB trust account that we have. So there was no, this was just booked potential expense, but it wasn't actually, no money was moved or transferred to pay that expense. It was just booked as expense. Am I explaining
Is
that?
that like a depreciation expense? An expense for depreciation? It's not really moving money, but it's accounting term.
Yeah, it would be similar in that, but
Okay, I understand that.
So they would book an expense in their financial statements, and the other side of the entry is a liability. as opposed to a credit, it's a credit to a liability rather than a credit to cash. And that's why they didn't allow it, because it was actually no payment made.
Yes.
But the liability still exists. At some point, there will be cash
And
that'll
it-
be spent.
Yeah, and at that point, then we would be eligible to get reimbursement for it once it actually becomes cash that we've had to expend.
So we got to make sure that in that future day, we show that as something we can get reimbursed for.
Yes,
But it'll be a cash item rather than a financial statement expense.
and we did get reimbursed for all of the items related to OPEB that there was cash exchanged for. So it was just those actuarial numbers that we were ineligible to receive reimbursement for and shouldn't have been included.
Well, and really, since we didn't spend money, cash money, with respect to those expenses, we didn't actually spend cash. Okay, you're gonna have to spend cash in some future year to pay it. And then and only then get reimbursed for it.
Right, right. Which is the confusion between how the Medicaid system calculates things and how it would be booked on the financial statements. Because for the financial statements, that is clearly included as an expense, but from Medicaid's point of view, until you've actually expended the cash, you can't include it as an expense.
I guess the concern I have ultimately is that you're gonna have to burn through over almost $4 million in cash to pay these things back. And then someday in the future, spend money to pay the actual benefits and maybe later on get reimbursed.
So what we would see is once we've actually had to pay out the benefits, then we would see that included in our Medicaid rate. So if, let's just say it was 2030, we would see it in our Medicaid rate in 2032. And that, unfortunately, is the lag that the Medicaid system has had historically.
And let her finish and then I'll recognize you.
So historically, the Medicaid system has always had that almost 2-year lag. So we would see that included in our Medicaid rate once we've actually expended the cash in future years, about 2 years after we expend the cash.
Okay, Commissioner Williams? That answered my question. All right, thank you.
So to just kind of clarify where that leaves our current position. If you can move to the next slide, please, that would be wonderful. Thank you. So with the adjustment that we've already taken for fiscal year 2022, we have roughly $4,300,000 in our cash balance. This is a sufficient amount to be able to return the estimated Medicaid rates, the Medicaid funds of 1.9, leaving us with 2.4 million. Now, that is not a cash balance that we've been used to seeing in our accounts over the last several years. However, pre-COVID, that was not uncommon to see our cash balance around that amount. Would I feel comfortable with more in that cash balance? Absolutely. But we have done it before without county support or needing additional funds from the county with that kind of cash balance, and we believe that we can continue to do that without any assistance from the county or impact to MOE. Now, once we actually receive the invoices, so we want to book all of this expense for this year, but once we actually receive the invoices, we'd like to reserve the right for the DHHS board to determine where cash on hand is at that time and whether we need to work out a payment plan with the state for how we actually pay that amount back. We've seen payment plans. The state plan allows for a 3-month payment plan, in some cases up to 2.5 years. And then we would make that decision, or the DHHS board would make that decision based on the cash on hand at the time of invoicing. But regardless, all of that money would be earmarked so that it cannot be utilized for any other things because it's already been booked as expense to
Well, you
this
had the
year.
liability on the books that you knew you had to pay.
Yes,
Is the money not due to the state at least until after the invoice?
correct.
So is there at least there's a year until they're going to invoice for the first one and another couple years until the invoice for the next one?
Potentially. The issue is, there's not a real clear timeline. Even from Plant Moran, who's is an expert in this area, there's the wiggle room of about a year in either direction. So that's a lot of time. And so just because there is the possibility that they could still request it early in 2025 or even still this year, we want to make sure that we have all those expenses booked and prepared to pay.
Well, booking the liability is a whole lot different than writing the check. That's what I'm wondering about from a cash perspective.
And
Mike has a question.
yes,
So you have the reserves, the real concern is the cash flow.
yes. So, and I don't believe cash flow will be an issue because we've run with this level of cash on hand in the past, pre-pandemic. The only time that could become an issue for us, that I believe, off the top of my head, would be when our bond payment is due. Because our bond payment is roughly about $800,000. So if we were to receive the invoice and the bond payment at the same time, then we would need to look at a payment plan to make sure that we have cash flow adequate enough to handle both.
I assume you're using a 12-month rolling cash flow analysis. I mean, we use one at the county, so, because we have the same challenges sometimes.
Yes.
Okay.
That's my understanding as well. So that concludes my special report. Is there any questions about that I can answer?
Chair Shotwell has a question.
One last question. You stated that you could request from the state of Michigan a payment plan.
Yes.
Would that assist you when you're dealing with if the bond payment and everything came due all at once also? So you have that option also?
Yes. Well, not with the bond payment. We wouldn't be able
Right,
to do
right.
it. But we could do that if the invoice came at the same time as the bond payment. So the window to do that is 15 days from the time we receive the invoice. So we would jump on that immediately to make that decision with the DHHS board. Any questions on that special report before I get into the quarterly report? Okay.
Go ahead.
So moving over to the quarterly report, which is the other PowerPoint. We changed the format on this a little bit, so hopefully you will find this helpful. If not, let me know, and I will switch back to the previous report format. So we are going to go through what we're working on for growth, quality, people aspects, finance, and then we'll end this portion. So for growth, I want to share with you that we transitioned our therapy team into being an in-house team starting September 1st. And I just wanted to share a few pictures with you of our therapy team in action with residents that have graduated from us on a short-term basis. So all of these pictures are posted to our Facebook page, and they've authorized us to be able to share that. But our new therapy team is doing a wonderful job. Here you'll notice our therapy dog, June, which is one of our therapist's dogs that she brings in, and the residents absolutely love their time with June. And even when they're not in therapy, seek her out just to spend some time with her. So she just celebrated her 9th birthday the other day, which was a big thing at the facility. So I did want to share with you a little bit about the metrics with our new therapy team. So our therapy team has been doing very well. In September, we had a net profit of $5,665.80 for the program, which is the very first month. When we were contracted out, our contracted company continuously told us that they were losing money on our contract. So it was very encouraging to be able to see that we were not only just breaking even, but we were actually making a small profit even within the first couple months. So October, we had a net profit of $5,846.89, and then November, we had a net profit of $6,171.01. We did hire some additional staff for the team. So even with hiring the additional staff, we've still seen that net profit. So we brought on a full-time speech therapist. We have a full-time physical therapist that is starting on Tuesday, 2 PRN occupational therapists, 2 PRN physical therapists, and then 1 PRN physical therapy assistant. And we're still looking for 1 full-time CODA, which is an occupational therapy assistant. So overall, we've done really well at getting that program staffed up to where we wanted it to be. Our next piece of growth we've been talking about is our leadership development amongst our team. So one of the phrases that we've been using throughout the facility is personal transformation creates team transformation. Along with that, this quote I thought stood very well. People rarely develop beyond the maturity of their leaders. So as leaders, we have an obligation to continue to mature at a higher rate than those that we work with so that we can continue to lead them down the proper path. So we all need to know to do the personal work of knowing ourselves and understanding ourselves and our individual mission and purpose and values in order to be able to help the team transform. So another quote that we thought was very helpful is an autopilot life constructs an identity that we are unaware of. So continuing to be very thoughtful and self-aware of the work that we're doing and how we hold ourselves so that we can help others strive for excellence. With that, we're going to move into quality. And I have for you the 5-star rating from CMS for our area. So we continue to be 5 stars overall. On the next page there, it'll also go through our survey star rating. We have 4 stars in survey, 4 stars in quality, and 5 stars in staffing. We are one of 3 homes with a 5-star overall rating. We are one of 3 homes with 5 stars in staffing. We have the second lowest nursing turnover in our market area at 44.1%, which I know to the rest of the world is shocking, but that's really good for our industry. And then the second lowest RN turnover rate of 14.3%. So this is a rolling 12-month turnover rate. And once we get into the people section of this presentation, you'll see our year-to-date turnover rate. Next slide. So we were awarded the U.S. News 2025 Best Nursing Homes List High Performance Rating. We're one of only 19 homes in the nation to have this distinction. And I thought that that was definitely worth sharing with you. So even though we have had our trials financially, you can see that we're putting that money into quality of care and developing a program that the county can be proud of. Under people, we have some updates here, just a few union updates. For those of you that don't know, we do have 3 different unions at Jackson County Medical Care Facility. We have MNA, which represents our RNs. We currently have no outstanding grievances, and we are currently in a wage reopener with them. AFSCME 2098A, which represents our LPNs and our health unit coordinators. We have 1 outstanding arbitration request, and we also have a wage reopener that's in progress. And then AFSCME 139, who represents our CNAs, dietary aides, housekeeping, laundry, inventory control, and restorative aides. We have 2 step 1 grievances and 2 step 2 grievances outstanding with them at this time, and we're currently in contract negotiations as we have a full contract to negotiate before the end of the year. Labor management meetings are happening monthly with AFSCME 139 and quarterly for AFSCME 2098A and MNA. Next slide, please. For recruitment and retention, in September, we hired 17 new care partners. This includes our 11 new therapy team members in that number. So when we brought them in-house, they're included in that number. We had 5 departures. In October, we had 4 new care partners and 6 departures. November, we had 7 new care partners and 7 departures. And our turnover rate to date is 25.86%. For people that have left after 90 days, it's 12.52%. That's a reduction of 22.37% from this time last year. So huge improvement in turnover, which we've talked a lot about recruitment and retention in this meeting over the last couple of years. So I thought that that was an excellent statistic to share with you, that we are definitely seeing a change in the tide there. The next page includes the CNA call-in and mandation trend, which I shared with you quarterly, and then the nurse call-in and mandation trend on the next page. I do want to note that our nurses have had, up until November, had no mandation for 6 months of the year, which is excellent. We have been steadily working on bringing that down over the last several years, but this was our longest stretch of time that we had no mandation for our nurses, so that was excellent. And now, we will bookend it with finance. Okay, so for August financials, revenue was behind budget by $164,526. Expenses were over budget by $58,482. Our net position was $223,008 behind budget. Our census for that month was 2.42 bed days behind budget. So this was primarily due to our census issues in the revenue side. We did see some higher than expected expenses on the health insurance side. Our health insurance is self-funded, so as the claims come in, we will see fluctuations from month to month with that. Overall, our budget for health insurance is aligned with what we had budgeted overall. We just see some months with higher expenses than others. For September, our revenue was $44,176 behind budget. Expenses were $25,205 behind budget, with a net position of $69,381 behind budget. And again, census was a major issue in September, so what we have found as we've headed into this last few months of the year, we've been having a lot of turnover in our census, a lot of short-term people looking to try and get home before the holidays, but we've also had a lot more folks that have passed away in the last couple months. So census for September was 5.37 bed days behind budget. I do want to draw your attention to the number of admissions and discharges on each of these months. I won't go through them individually, but you will see that there continues to be an uptick in both admissions and discharges as we head through the end of the year. And then for October, revenue was $37,401 behind budget. Expenses were $180,121 better than budget. Net position was $142,720 less than budget, but still net positive. And then our census was less than 1 bed day behind budget. So we were very close on our census. We definitely did better in expenses for the month of October. We did a lot of work with our nursing team looking at the number of enhanced shifts or premium shifts that we had to offer during the prior months and seen quite a reduction in that.
So just for everybody's edification, that 142,000 in red should be 142,000 in green. You were better than budget for the month, right?
So we were, oh, yes, it should be. Thank you.
As opposed to the red we've seen in the couple months before that, right?
Yes. And I'm really kind of bummed out with myself that I didn't catch that should be green, because I tell you what, when I started highlighting red and green, I was like, oh, this doesn't look great, but, I just want to be honest about where we're sitting, so.
Just so everybody's
So,
kind of clear
yes.
on that. October was better than budget, yeah.
Yes, I will take that as a green, and I will re-highlight it that way. So for 24 year-to-date, our revenue is $12,004 behind budget. So we're very close to budget on revenue overall for the year. Expenses were $910,139 behind budget. Now, about halfway through this year, we did make a budget amendment that was pretty considerable for the last half of the year. One of the things we found in the beginning of the year is we did not have enough FTEs budgeted for LPNs. Because of our change to 12-hour shifts, we ended up bringing on a lot more nurses than we had originally anticipated. And that was not reflected accordingly in the budget. So the second half of the year, the budget did address those expenses, but that's where we've got this offset. Change in net positions from operations is 922,143. And then change in net position, including non-operating income. Now, I want to draw your attention to this line because this is where we booked that 1.5 million, which we're going to change to 1.7 million plus 1.9 million. So the next time you see this for the year, it will look even worse, just to prepare ourselves. But the change in net position, including non-operating income, is $2,144,506. Census overall was behind budget by 3.06. We've had a total of 460 admissions and 388 discharges this year. This number, as of November, was already higher than where we were at the end of the year in 2023. For October was already higher than where we were at the end of 2023. So we are definitely seeing more turnover in the amount of residents that we have coming through the building. The next slide here that you have is our census graph to date, so you can see those fluctuations in real time across the year. So that shows you the trend line. The next slide there, AR days remain above our goal of 54 days by 58 days, so we're about 4 days away from our goal on AR days out. Cash on hand is estimated at 52 days. This does not include the money that's earmarked for the repayment of Medicaid funds. If it did, we'd be more at 72, but we're taking that out of that day's cash on hand count for you. Or the funds that are currently invested or MOE funds. Overall, those funds in total are approximately 5.5 million in additional funds. We do not project any additional MOE usage for 2024. And the final slide is just a Merry Christmas, Happy Holidays from all of us. And this is our therapy team all together, so we just thought we'd share that picture with you. Any questions that I can answer for you?
Commissioner Williams, please.
Thank you, Mr. Chair. So just a quick question. On your slide here, you have reported the discharges. Are deaths included in that number as well?
Yes.
Okay. So, I mean, it goes without saying we have some significant financial issues that we will work through. But I am encouraged with the retention efforts. I know that's something I have stressed, well, fellow commissioners as well stressed, the need for that. And as we're beginning to see the results of that is encouraging. But yeah, we certainly have some financial issues that we can work through. We've been in similar position before, and I'm confident that we'll get through it. Thank you. Nothing further,
Thank you,
Mr. Chair.
Commissioner.
With respect to the balance sheet that we see, we didn't really talk about the balance sheet to speak of, but it's a relatively condensed balance sheet. And I'm going to look at current liabilities, at least as of, this is October 31st, as an example. It shows current liabilities of 1.88 million. I mean, I'm sure those are normal payables and operational liabilities, but I guess I would like to see a breakout in future months as the liability for the settlement is arrived at or booked. I guess I'd like to see that as a separate item so we can kind of keep track of it.
Okay, absolutely.
You understand what I'm saying there?
Yes.
Okay.
Yes. And I do believe that actually on page 3, down under changes in net positions from operations, underneath that has non-operating income / expense. The second item down, prior year Medicaid settlement, is listed there.
Right, I mean, I see, okay, so so of the 1.88 million in current liabilities, 1.193 is for the, that one prior year Medicaid settlement item?
Yeah, let me research that a little bit more because I was expecting that to be a little higher, and then I'll look at the liability that you've asked for
I just want to
as
make sure
well.
we keep the liability on the balance sheet where we can kind of keep an eye on it, okay?
Yep.
To know what that is. Normally, we don't want to know details on operational liabilities, but these are big bogeys.
Yes, absolutely.
Yeah, yeah.
I will ask that be changed for,
Mike has a question.
Actually, Mike has a statement. I know what it's like to have lemons sometimes, have to make some lemonade. I got to tell you, over the years that I've known you now, I've watched you progress in the MCF, and you're doing an outstanding job. Think about where we've been in the MCF with contracts and negotiations and turnover and all the challenges financially and otherwise. Kudos, you're doing good. You hang tough.
thank you so much. Thank you.
The chair will entertain a motion to receive the report of the medical care facility. Thank you, Commissioner Snell and Commissioner Williams. All those in favor will please say aye. Aye. Any opposed? Thank you. Thank you, Destiny.
Thank you.
And now the medical examiner's report. Welcome.
Thank you. Dr. Mano is out of town, so you're stuck with me today. As you can see, I submitted August, September, October for our quarterly report. We've been running pretty steady between upper 30s to 40 to 50 cases a month on average. I submitted the little trending chart for you, hopefully that helps you out. Just so you know, between the three counties, Lenawee, Hillsdale, and Jackson County, of course, January through October, we had 851 cases total and 282 autopsies. That would also mean that, we've had a decent number housed in the morgue. We've had 349 people January through November in the morgue for either storage or autopsy. I also submitted drug statistics. There's a national trend right now for drug fatalities, and that's a downward trend. So I think we're following that as well. January through August, we had 22 total drug-related deaths. So that's good. Lenawee and Hillsdale counties are both down as well. I think Hillsdale counties had like 2, but of course they have a smaller population. Just so you know, our November was pretty steady, but of course during the holiday we became very busy. So over Thanksgiving and currently we are full. We have full occupancy. It seems as soon as we have somebody removed, we get somebody else. So we're trying to keep on top of that. This fall, we've been very busy, especially me. We did do a tour for the LISD, Lenawee Intermediate School District. It's a tech center. They have a biomedical class that came in, and we gave a tour of the morgue, and I spoke with them, and Dr. Mano was available for that, as well as another pathology assistant, and of course, the other office staff were present for that. We've also had a small tour for a Columbia Central group, kids interested in medical careers. In November, I was able to attend MAME, actually, for the first time. I've never gone before. I've worked for medical examiner for 25 years, and this is the first time I've attended. It's probably because the first time I felt I had enough support back home that I could actually leave. But that was very enlightening, and it's also good for making connections with other medical examiners' offices as well. So that was up in Soaring Eagle Casino. They have a conference facility there. On Thursday will be my 6th career fair this fall. I've done many career fairs. This career fair will be at Adrian High School on Thursday with 10th grade. and that's working with Lenawee Align. It's a very interesting program. So that'll be fun. I have done a Jackson career fair at Jackson College, and it was well attended. Last week, I did a hospice presentation at the Henry Ford Hospice House with their nurses there, and I have a presentation with them in January. I answer any questions they have, and it's mainly about what the medical examiner, why we do what we do, and what deaths are reportable to our office. On Friday, I was in Oakland County. Oakland County Medical Examiner put on a mass fatality tabletop exercise, and I took part in that, as well as two investigators from Jackson County, Chad Everett and Nat Gross, and then an investigator from Lenawee County, Dave Nowland, and one of our deputy medical examiners, Dr. Brian Now. We all attended that. We were seated at the same table, so when it came down to practicing our exercise, we were really able to chat with each other, work through some problems, and figure out what we should be doing next. It was very enlightening and very beneficial for all three counties. Last week, Henry Ford Jackson Hospital called our body and notified us that they had some unclaimed bodies, and we're like, okay. Well, it turns out they have 5 unclaimed bodies, and we're not very happy about it. This is Jackson County. This is the hospital morgue. So they have 5 people that are unclaimed, not just a couple. One of them has been there since June. One has been there since August, one since September, and 2 from November. They call us and ask us to take care of these deceased people. I cannot just do that at their word. We have to do our due diligence as well. So Ellen Spalding, who is part-time in our office, has stopped what she was working on, and she started working on collecting information on these people. She has spent hours on this. We have, at this point, out of the 5, we know 1 is for sure unclaimed. But she did find relatives, I think, for almost all of these people, and we are hoping to hear back from them. But it does take hours of work. We have, in order to take care of an unclaimed person, we have to do our due diligence, the best we can with what information we're given. And I just wanted to notify you that had occurred.
Do we have to find out how they died then, or if they got a certificate that they died in the hospital?
Right. Usually if they're dying in the hospital, the doctor signs the death certificate, a hospitalist, unless they are a medical examiner case, and then we would be usually bringing them into our facility. They are not in our facility. They are at their facility.
What condition do you receive these bodies in?
Well, we're not going to, I won't take them unless I'm forced to. I don't have room. So what will happen is, after our due diligence, if they remain unclaimed, we will contact a funeral home, and I have to file for state emergency relief, which was mentioned earlier. And then hopefully the state will hopefully make a payment to the funeral home. And usually the funeral homes are very nice, and they work with me. They'll take care of the decedent. They'll cremate the decedent for us, for what the state pays. If the decedent is very large, I have to pay them a little bit extra because it's more expensive to cremate somebody who is very large.
Well, I'm just thinking, if they've been there since June, are they
They're not.
valid term processed in any?
They are not in a good state. They have been left alone in a body bag in their cooler. Yeah.
Okay.
Yep. So my funeral home that will pick them up won't necessarily be happy about that, because you can imagine.
Do you rotate around the various funeral homes to take
I have 2
difficult
that are
case?
willing. Usually I go with who's willing to help me. Watson Funeral Home and Lauer are the two funeral homes that help us the most in Jackson. Obviously, if, I know some funeral homes will not do it just for what the state pays. But I have had a funeral home that has told me that in the past that has helped with an unclaimed body. Usually it's because the body's already at their facility and they've been abandoned.
Sure. Thank you for the work you do. Please continue.
That is all for me. Sorry to leave you on a downer.
It's unlikely to be a celebratory visit from you,
It's
yes.
the morgue.
So,
We try to be at the best morgue in the state, but
well, thank you.
have our
Thank you for your
moments.
diligence and your passion and your compassion, okay?
Thank
you
you.
for that. Questions from committee? Commissioner Williams, please.
Thank you, Mr. Chair. So you certainly don't have an easy job, and so we
No,
certainly
sir.
thank you for what you do. But I'm curious, and maybe this is a question or discussion that we can talk about later. But with having a deceased person at the hospital for so long, although they are in a cooler, are they given any type of agent to slow the process of decay at all? I mean,
No.
just to really?
no. And they do not
Wow.
have a freezer. Our long-term storage at our facility is the freezer. They
So
do
the-
not have a freezer.
So they're just out at the hospital?
They're bagged. They're bagged in a refrigerator.
Well, yeah, so that's what I was referring to.
Yes.
So outside of just having the refrigeration, there's no
There's
agent
no other
administered.
thing that they're doing.
Wow. Okay. Wow. Okay.
That's very nearly malpractice at the hospital level.
Yeah,
it
I
seems to
don't,
me.
I don't know what it would be considered. I don't know.
Well, it's just
It's
bad management
not
to
nice.
have that go on for as many months as that.
And they have had some management changes, and since this has happened, we've discussed amongst ourselves at the morgue, Jackson Morgue, that perhaps we will go over there and have a chat with them and maybe give them some better ideas of how to handle that type of a situation,
Yeah.
because we expect them to do their due diligence first. They
yeah,
can't,
you
we
shouldn't
don't
have
let
to
them,
step
yeah, we
up
don't
again.
let them just say, hey, nobody's come and got this person. But we still have to do our due diligence on top of anything that they've done.
So at the risk of asking a question to which I do not know the answer, is there anything in your facility that you need from us to help alleviate the issue you experience currently? You're full up.
At this point, no. But if it gets worse, we do have, it costs more money, but we could always, there is a facility down I-94 that we could have additional decedents stored at, if we needed to. At this point, we haven't needed to, because we've been rotating in and out.
Well, then that's really no better in our case than the hospital doing what they've done, which is to kick the can
But we haven't
down
had
the road,
anybody in
excuse the
there for
expression.
6 months, that long.
Yeah.
We're just very full.
Yeah.
I guess, what's the analysis on storage versus cremation? I mean, do we keep a body 3 months and then cremate, or?
Right. Right now, we hit about that 14-day period, about 2-week period. And then unless we have something in confirmation, like we would never want to give up on somebody that's really genuinely trying to do something for their loved one. I don't know that how often that actually happens, but we would never want to give up if we could store them in the freezer, give the family a chance to claim them, because if they do not claim them, we house the cremains unless they can pay us back and the state back. But yeah, I don't know what else to say. It's just a problem we run into from time to time, and our busy time of year is November, December, January. I am looking to purchase another cart to help alleviate some of our issues with the next new budget year, but I don't know if I'll be able to do that.
I have other questions that I want answers to, I'm not gonna ask here.
You would be more than welcome to come to the morgue. If you want to call ahead, you can come over anytime. I'm there in the mornings.
Steve, if you go, I'd like to go too. I guess I'd be curious. I'm serious.
Yeah.
I'd be,
More than welcome.
I'm curious.
Yeah.
Yeah. Okay, sounds like you have interested commissioners here. I want to express, I hope, on the part of all of the committee members, our appreciation for the very difficult work you do, and thank you for it.
Thank you.
Chair will entertain a motion to receive the report. Thank you, thank you. Commissioner Williams and Commissioner Willis, all those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
Merry Christmas to you. Now we move on to the Department on Aging. Madam Director, good to see you.
Good afternoon. Just a few things with my report this month. One of the attachments that you'll see is our statement of contract award with Wellwise Services. And this is our contract award that will go through 12/31 of '24, and then we expect a new one once they hear more from the state about their funding. On the contract award that you have, the two areas that I always kind of talk about are the congregate meals and the home delivered meal budget. And it's mainly on the federal side. They put a lot of dollars into the federal side, so you can see we're awarded about $49,616, and that's through December. And then the same for meals, home delivered meals. It shows the award to date at the end of December will be $37,111. When we look at those two programs and we look at our budgeting of that, we're probably at like a 90-10 split, meaning our funding, we support home delivered meals about 90% and then congregate meals about 10%. So we see, again, the expenses higher on that home delivered meal side. And I think the state, which is just still below the federal, when you look at that number, is like 44,732. You can see that even the state sees the high demand for the Meals on Wheels compared to the state side, where if you looked under that for the congregate meals, and they support it by like 902. So you can see the demand is very high in that area. What we'll do is we're spending probably on the federal side about $8,000 a month that we're getting reimbursement for. And then come probably May, June is when we'll ask the state to do a transfer between those two program areas. So we will get the money out of the federal side, but we have to wait till we can do that transfer. So we're kind of expending everything out that we can on the home delivered meal side, and then we'll look for that transfer to happen. So I just wanted to touch base on that. And then we also received our program audit results from Wellwise Services. And again, I'm always amazed at our team that pulls us together. Throughout the years, we're working on that audit piece. With the part that they do for client assessments and making sure care plans are done, case notes, what you did to coordinate for clients. They're randomly going to pull a case file maybe out of like 800 to 1,000 people. And so when they pull that, you know, you're always hoping everything goes well with that. And it did. Our team does very well with documentation, and that was noted in that report. So again, thank you to our in-home service team for making sure that all those case notes and all little X's and T's are crossed and everything like that. So our audit turned out very well. And I've talked a few different times here about changes with the Medicaid, Medicare Assistance Program. And so this is just another update with that, talking about this new initiative, grant funding opportunity called the No Wrong Door. And this is something that we're working with Wellwise Services on. The state basically has ended what they call the MAP Inc., which is the Medicaid Medicare Assistance Program. And it's all going under this new grant opportunity to also include something called options counseling. So the total available for the grant opportunity across the state of Michigan is like $16 million. And the state hopes to award between 9 and 20 different grants. And so we're working with Wellwise Services to still be able to do the work for the Medicare, Medicaid piece, and to support the residents in our Jackson community. What I wanted to do is just kind of lay the groundwork that this grant opportunity is going into place, they have to submit their proposal by December 19th. they will know by the end of January. And so we're giving them kind of like a letter of support that, yes, we'd continue to like to work with them in this new program. Maybe some ideas on cost for us to continue to do that work. And then what I would do is if they are awarded that, come back to the Human Services and talk about what that, our agreement would look like in the future with that particular grant initiative. So this is just kind of the preliminary groundwork that lets you know that changes are happening. There's different things that are going to come into play where basically residents can call like a 1-800 number and say they're interested in long-term care solutions and want to talk with somebody, and then they're going to get connected to whoever that local provider is going to be in that community. So we're still trying to remain within that piece of that network. Also, just an update on some kitchen equipment. You know, things have to get replaced here and there. We did replace a reach-in refrigerator. The one thing that I like about our kitchen team is always looking at when you're going to expend something on a large purchase. Do you continue with just what you've had in the past? Do you do the whole 3-door, or are you ready to downsize into something else? And working with the kitchen team, you know, they really kind of looked at what they needed, and they just needed a 2-door. So you're still looking at like about $1,000 to $1,500 saving by just, you know, working with the team, not just going by the status quo and being able to save some money there. And that will be sufficient to serve the needs of the kitchen team for that refrigerator. Just a few things with our holiday giving. It is that time of year. You know, our seniors have been blessed by different support that we have received. There was an individual that wanted to adopt 15 seniors, and we looked at some high-need clients, and she's going to purchase those things for the clients, and then we'll get them out to each person. Country Stitches has always been very supportive about the home delivered meal program, and they again donated 50 placemats to be taken out to home delivered meal clients. And we always definitely look for people that need that extra pick me up or could use a smile for the day and kind of you know, highlight something nice for them to happen. And then our Granny Square group, who gets together weekly and puts blankets together, donated over 100 blankets that will be given out to home care and home delivered meal clients. So as the home care clients have been coming in, they think about different people that they serve and who could use that extra little, again, pick me up, or, you know, something to show that somebody's thinking about them over the holidays and taking those blankets out. So we appreciate all that they do. They also had some additional blankets that they were able to give out to John George Home, the Friendly Home, as well as a few to the VA office. And I just kind of wanted to highlight at the end just you know, the Crouch Center Fund that we have going on. There's a bunch of pictures on the end of the report to highlight a few different things that we're working on. The second picture, when you see those TV screens, when you think about that we have a very big Wii bowling activity that's happening now. We used to just have one TV, but it has grown. We have 2 TVs. They have competitions. So definitely it's good exercise. And again, just that social aspect of that group getting together. They're having a lot of fun. So just to highlight some things that are going on at our center. And I can take questions.
Chair will entertain questions for the health, the senior department.
Yes.
If I could talk to you after the meeting.
Go ahead.
Okay.
Corey, you can, you just want it afterwards. Okay, very good. Well, the chair will entertain motion to receive the report. Thank you, Commissioner Willis and Commissioner Williams. All those in favor will please say aye. Aye. Any opposed? Thank you. And Merry Christmas to your crew down there, Danielle. Thank you for all the good work.
All right. Thank you.
Thank you. And now the Health Department. Thank you for your patience.
Good afternoon. I will go through, I have a pretty easy, typical report that I report on, starting with community health, education, and promotion on slide 2. The last time, I was not here last month. I think Matthew Budd was here last month, the deputy. We were in the midst of our first accreditation, and I hope to report some great news on that once we receive our final findings on that. It was actually a technical assistance accreditation. where we wouldn't have any corrective action plans coming from it. But everything that I've heard so far and the ones that I sat in, our team is doing really well. So I hopefully next month I can report, the specifics on that. One thing to note just about our team and our staff, listening to the medical care facility and talking about turnover rate, we've, had that as well. Of our leadership team and supervisory staff, only one of our team members has gone through a state accreditation in the past. The rest of us are all new, and a lot of the staff, are all new as well. So that was a learning process for many of us, but like I said, I anticipate really high results from that. So the last time I was here, I think I had just talked about our health educators and some turnover within that department and having new staff. And I'm proud to report on here that within the last 2 months, they started in October. We had 4 new positions start in October. And since that time, they are out in the community, already set up with schools because we were a little behind on the timing of starting right at the beginning of the school year, but they are in the schools now. And like our Empowering Youth and Teen Pregnancy Prevention Initiative program, our top program, is in there, and they are in there and working. We still have our COVID Safer Schools grant with our health resource advocates. That's on the next page, and we have 2 working within that position, 1 full-time and then 1 who works part of their hours in that program. And just having new eyes and new thoughts coming on how, to do things and new initiatives to start. They've been able to really expand on some of their vaping, or the anti-vaping programs within the schools, which is one of the things that the schools are really asking for. We're starting to do I think it's a monthly news kind of letter there, an information section that goes out to all of our schools, and that gets sent probably electronically in like a weekly update that the schools send out. So trying to get that information out about immunizations and health and staying healthy, and ways that parents can talk to their kids about some of those issues. Hearing vision and our dental program, there isn't our kindergarten oral health assessment. I don't have any updated numbers, but they are up and running and working alongside our hearing and vision program. Community health, our maternal infant health and children's special health care and lead information is on there with their numbers of clients that they're serving on a monthly basis. SNAP education and marijuana both have ceased for the remainder of this year and will restart after the first of the year. Our outreach health educator, this is the time of year where our outreach slows down a little bit just because of there's not as many community activities going on. But what is nice about having someone who's really looking for those things is she is finding places to go and promote either well-being or, initiatives we have. We did a flu clinic at Spring Meadows. We also are working a lot on our translation of a lot of our brochures and forms and programming. Spanish is the highest need in our area, in our clients that we see. So getting those things translated and materials out on the table where we're at. I want to note, because I mentioned a flu clinic on here, it's really part of the personal health and prevention division, but it does cross all areas. I've mentioned before that we've been working on commercial billing and what a process that is. Who knew that it took months and months to become credentialed with an insurance company? But we actually had contracted last year with a company to help us do that, and actually ended that contract because they were getting us nowhere. And our senior account clerk and our clerk have been successful on their own. So we saved some money there, plus we're going to start billing. But Priority Health, we started with Priority Health and Blue Cross Blue Shield. We started with Priority Health because the county insurance was Priority Health, which is ending it this year, but we are credentialed with Priority Health. So anyone who has Priority Health in the county can come to the health department for flu shots, COVID, RSV, any other kind of immunizations. I'll be talking about whooping cough or pertussis in a moment, the Tdap shot, and then our Blue Cross Blue Shield. I have heard that it's in the works, and we may be testing that within the week. So that's exciting. One of the things that I want to, say why that's important, and one of the reasons that our Matthew Butt, our Deputy Health Officer, really pushed for that a couple years ago was, or what I remember, he may have a different story, but what I remember of that is, we have a child in our immunization clinic who parent brings them in for their immunizations, and then their sibling may be sitting next to them, but we couldn't, they may have insurance from their father or some other source, and we couldn't immunize that child. So, you have siblings and you have one come in, we can give them all their shots and the next, and the chance of them going back or going to another provider is kind of low, even though, so we want to take advantage of that opportunity to be able to provide the services while someone is within our care. Starting with personal health and prevention, on the next slide, it is noted that the MDHS visit, they had site visit back in August, and that was noted as the staff there is doing, not only meeting all of the standards, but are doing a fantastic job. They'll come back in 2026 for another site visit. Our immunization clinic in their room hosted them along with our WIC staff. We had an Autism 101 training for staff and other community members. So our staff, basically we just want to teach our staff, and provide the training that they can best service the, different types of individuals that may be, within our care. I wanted to try to link this next one, the Spotify ad, into this, but I couldn't figure out how. Our outreach health educator and our clinical services director worked on, we have some advertising funding, and it's primarily to advertise and focus on people getting flu, COVID, RSV, those winter respiratory diseases. And we found that Spotify has a really good deal on advertising, and it's really intriguing. They showed me how you can narrow it down to certain areas, certain zip codes, certain geographical locations. So as people are listening to Spotify on the radio or on their AirPods or whatever it might be, when those ads come up, it's just a 30-second interview for a really good deal. And we've been able to, just in the first little bit, reach 7,200 unique listeners for under $100. So the impact of that will be hard to measure, but just the ability to reach that many people and get that in their ear is important. I mentioned pertussis and whooping cough. We are really trying to promote that, getting a Tdap booster shot. If you have priority health, come to us and we can do it for you. But we've had 11 cases within Jackson County. We have a couple people being under care for TB as well in the community. One quick thing to note on the WIC program, although we've seen decreasing numbers since COVID of our overall enrollment in WIC, and you'll see some numbers going down. What I don't want to overlook with those, the decrease, is that our WIC program brought $2.68 million worth of money into our community at local Jackson stores. So again, although it's a little down from previous years, it's still a significant amount of money that's coming into our local community. Environmental health, we are still without an environmental health director. I am going to work with HR actually this month, as soon as I'm back to more full-time work, but work with HR and our coordinators there on how we can perhaps realign and redistribute some responsibilities. The director position is just not something we are getting applicants for. We've boosted some ads and paid a little bit of money to try to boost and try to reach people, but I haven't had an applicant for that position since August 30th, and of those applicants that I've had, none are qualified. So we'll just continue, at this point, I really think it's just something we need to kind of reorganize and reprioritize responsibilities. You will see the ever-ending environmental health Arbor Village mobile home park. There's a note on there. Thank you, Commissioner Pulaski, for kind of convening some of the powers that be to meet this afternoon. We will meet this afternoon. The health department doesn't have oversight of this mobile home park, but we've really, when Don was here, and since then, we've really tried to keep the pressure on the state, Eagle and Laura, on what's being done, because things aren't being done, and and our individual residents in that mobile home park are, suffering because of that. So we will meet with, I believe, State Senator Office and, I'm not sure who else was on the call, but
Rep. Leitner, I think, will be there. I'll be there. This is in Spring Arbor Township here in another hour or so. I'll be there, and then you guys are there either by Zoom or in person. You'll be there on purpose, I'm sure.
I'll on purpose be there, yeah.
Well, and I appreciate the health department paying attention to this, because even though we don't have jurisdiction over the issues that face Arbor Village, if somebody gets sick out there, we're the ones that are gonna be, the cameras will be turned to.
Yeah, absolutely.
So, yeah, we want to pay attention to that. Don was very good about doing that. Thank you for picking that up. And we'll see.
Yeah, we'll
what
see. We'll
Eagle
have
can
news
be
perhaps
prevailed upon to do.
where that goes. One thing that's not on here too is another area where we are not directly involved, but is the PFAS issues with Missioner Plating and other, we have 2 sites within the county that we remain just in the know and try to keep, however we can be a liaison to the community for those. We do as much as we can with those.
Questions for the health department?
Thank you.
Thank you for the work, and carry on the good work, and hope your arm feels better.
It's on the mend.
There you go, good. The chair will entertain a motion to receive the report. And thank you, Commissioner Williams and Commissioner Snell. Thank you. All in favor will please say aye. Aye. Any opposed? Thank you. And now on to claims. The chair will entertain a motion to pay the claims. Thank you, Commissioner Willis and Commissioner Williams. Any questions? They have been around. I think they were down in front of you, Commissioner Bear. The claims, you were the last one to sign. So all in favor of paying the claims will please say aye. Aye. Any opposed? Thank you. Other minutes, please take note of the VA meeting minutes, the DHHS board meeting minutes, both regular and special. Reporting schedule then for January, we'll have the Department on Aging and the Health Department. We are now up to public comment. Public comment is now open. Any public comment? Public comment is now closed. Committee member comments, please. No committee member